name is Dr. Naveena Bobba. I'm the Acting Director for the Department of Public Health. Last month in San Francisco, 59 people died of an accidental drug overdose, according to preliminary data released today by the Office of the Chief Medical Examiner. This is a 17% decrease when compared to the month of January 2024. Since April, we have seen a monthly year-over-year decline in overdose deaths. In 2024, we saw the lowest number of overdoses since the Office of the Chief Medical Examiner started tracking this in 2020. However, we continue to see a disproportionate number of Black African Americans dying due to overdose. Despite representing just 6% of the San Francisco population, 28% of preliminary overdose deaths in 2024 were among Black African Americans. That means that Black African American San Franciscans are dying at a rate 5 times higher than the citywide rate. We have seen some progress. In San Francisco, medications to treat opioid use disorder, like buprenorphine and methadone, are used by Black African American people about 5 times the rate of the city average. We want people who use fentanyl and other opioids to know that these life-saving medications are available through the Department of Public Health. Last year, we launched on-demand buprenorphine with a focus of nighttime telehealth outreach in the Tenderloin. Every night, this program connects people in the Tenderloin and South of Market on the phone with a medical professional that can prescribe buprenorphine in real time or connect them with a methadone program. And we are happy to say we are on track to bring this service to the Bayview neighborhood this spring. We will be in the Bayview getting people on the phone with a doctor when they want treatment. This is just one program we are launching and expanding to reach Black African Americans who want and need treatment. We remain committed to evolving our outreach, engagement, and services to ensure the communities most impacted by the overdose receive the care that they deserve. I welcome Dr. Hillary Kunins to the podium to highlight some of our other efforts.
Thank you, Dr. Bobba. I'm Dr. Hillary Kunins, Director of Behavioral Health and Mental Health SF for the City of San Francisco, Department of Public Health. As you heard from Dr. Bobba, Black African Americans are dying at a higher rate than other community members in San Francisco, and this is true across the country. This is a tragedy. I want to share some of our ongoing efforts to reduce overdose deaths in the San Francisco Black African American community, in addition to the ones Dr. Bobba highlighted. First, I want to thank everyone who came out to San Francisco's first Overdose Prevention Summit on January 30th. This event was organized by a community stakeholder group of Black voices that meet monthly to strategize ways to close the gap on these overdose disparities. Disparities are a critical issue for us locally and nationally, and we value and depend on our partnerships with community and with people with lived experience. We are working diligently to deliver culturally congruent services, including in every city shelter and navigation site, in every permanent supportive housing building, providing on-site substance use treatment, mental health services, and overdose prevention education. We know there is ongoing need to expand services. Our street health team is one such example, which provides on-site medical, mental health, and substance use care. As you heard, our street teams are using telehealth to provide immediate access to people to buprenorphine, in many instances walking them to a pharmacy to retrieve their medication. This year, we will further refine and extend these services. In addition to the new Bayview program, the Public Health Department is working across a number of different organizations that are Black-led and Black-serving. For example, we are working with the Homeless Children's Network to launch a new substance use awareness and education campaign focused on reaching Black African American San Franciscans. Additionally, we are expanding culturally informed treatment and recovery services and focusing on African American men over the age of 50 who are most affected by overdose disparities. San Francisco Department of Public Health will open the Shop, a culturally familiar and welcoming site for older Black men to receive substance use services and other supportive resources. And after fentanyl, the greatest contributor to overdose are stimulants, methamphetamine, and cocaine, for which the most effective intervention is contingency management. The department currently funds 10 contingency management programs and is near to opening up several more, including one tailored to reach Black African American community members. In addition to launching nighttime telehealth in the Bayview, Department of Public Health will also be offering and expanding peer navigation to treatment programs in the Bayview neighborhood. So whether at our mental health programs tailored for Black African American San Franciscans, in our hospitals, in clinics, on our streets, we are focused on every way that we can to extend our culturally competent, trauma-informed services to individuals who've experienced institutional racism and trauma. Closing the gap on overdose disparities and other health disparities is a major public health challenge, but one we must continue to address with vigor and relentlessness. And now I'm so pleased to be sharing the podium with Antoine Matthews, who's Senior Director of Youth Services at Code Tenderloin and one of the leaders of the community stakeholder group I just mentioned. Following Antoine, we will be joined at the podium by Siobhan Allen, who you will recognize from our Living Proof campaign. Antoine.
Thank you. Good afternoon, everyone. I'm Antoine Matthews, the Senior Director of Youth Programs at Code Tenderloin. We are a workforce organization that works with Black and Brown youth and youth of all ages to build out and focus on business, technology, STEM, and public health measures, to focus on workforce development within the students that we work with. We also teach them about sexual health, reproductive health, and drug prevention so they can protect themselves, but also take public health lessons back into their community through the projects that they focus on. We're trying to foster and mold the leaders of tomorrow. I am also one of the co-facilitators of a community stakeholders group focused on ending overdose disparities in San Francisco. Last month, I was the moderator for our first community summit focusing on overdose prevention, bringing a range of Black voices together. It was amazing to see how many people we have in San Francisco who are passionate about helping African Americans in the Black community. This is a critical issue that not one person or one group can solve. It's something that we have to do collectively. Because of the hustle and bustle of the days, we oftentimes don't think critically about the different disparities that's impacting this issue. The summit gave space and voices to individuals to come about and talk about effective solutions. There are a lot of efforts being done, but they are not changing statistically fully. We need more investments, more partnerships, and more reach to make a difference. And most importantly, we need to address the underlying issues of substance usage: racism, poverty, housing, mental health, and trauma. Overdose disparities are not an issue that we are going to solve in 1 year. It's a continuous effort, and it takes everyone. We need city leaders in our community to work together to not give up on people in the solution. Thank you. I would also like to bring up Siobhan to the podium.
Hello everyone, good afternoon. I'm Siobhan and I am living proof that recovery is possible. I lived a very normal life before I became addicted to opioids. I grew up in San Francisco, all over many neighborhoods. I'm I guess you could say a Black unicorn, and worked to put myself through college, and I reached my goal for becoming a special education teacher within the San Francisco School District, a job that I loved. Everything changed in the aftermath of a traumatic birth. I experienced temporary paralysis that led to neuralgia, nerve pain, and I was overprescribed painkillers. And before I understood what was happening, I was addicted to opioids. I spent close to 2 decades battling addiction. As no one goes to school to become an addict, I didn't know what was happening and experienced a lot of hardship. Lost everything, myself, my dreams, my family. But I wanted to recover and get my life back, but I didn't know how. I had never seen anyone who was successful in overcoming addiction. And there's a lot of bad information out there. But for me, buprenorphine changed that for me. It wasn't the magic cure-all, but it did address the painful withdrawal symptoms and kept the cravings away. As for many addicts, maintaining, not becoming what we call sick, going through withdrawal, especially when you're unhoused and a woman, is something that you sort of build your life around. So buprenorphine, what it did for me, it gave me time and space so that I could recover and I didn't have to deal with those cravings, and I got a chance to rebuild my life. I'm so excited to hear that the Department of Health is making it easier for people to get access to buprenorphine and into treatment. I wasn't even thinking about recovery when I started my journey of recovery. It started with an emergency room doctor just informing me that treatment was available and that if I was interested, it was there for me. And what I heard was that possibly I could do this and that my life mattered. And he encouraged me, and I took that chance, and my life has been different ever since. Because of my experience, I understand that it is critical that people in addiction should be offered treatment and support at every touch point with healthcare professionals and first care responders. I spoke recently at an overdose prevention summit last month and was inspired by all the people in our community who are so fired up about reducing these disparities, especially in the African American community. The African American community has been neglected for too long, and I'm excited about the work that Department of Public Health is doing to address these overdoses within our community. I'm proud to be part of the Living Proof campaign and the recovery community here in San Francisco. And I'd like to say that in addition to having these beautiful images, posters, it's much more than that for me. When I walk down the streets, I'm very visible in my community. I do walking tours, I lead groups, and when I come across people sitting at benches that I used to sit at and didn't know where to go or how I was going to get out of that circumstance, I walk up to these billboards, these posters, and I look at people and I talk to them. And first they don't think that it's me, and then they look and they feel so seen, because I remember what it was like to be unseen. And I don't preach, I simply share my experience. And that's why I do this work, because I was once a mother who, returning to a stable, normalized life seemed like 1,000,000 miles away. So when I see the other Siobhans out there, I'm able to share my story and represent what living proof looks like, and that recovery and returning to a meaningful, purposeful life is possible. And my hope is that the Living Proof campaign will inspire others to make the change. The San Francisco recovery community is here and should be here for people when they're ready. Thank you.
Thanks.
Yeah.
We do have a couple minutes if